Hi everyone, I'm going to start this presentation with a little riddle. See if you can guess what we're talking about. I don't announce myself, but I'm here to stay. In your bloodstream, I silently make my way. Years may pass and still no sign, but left untreated, I can make you decline. What am I? If you guessed hepatitis, you're right. We're talking about hepatitis C today. So, what is hepatitis? First of all, it's a virus that's in someone's blood. They acquire it through blood to blood contact. It causes inflammation of the liver. People can be asymptomatic sometimes for decades. It can cause cancer, scarring, and liver cirrhosis. How is it transmitted? Like I said, it's from blood to blood contact. So the blood from an infected person needs to get into the bloodstream of an unaffected person. Who's at risk? IV drug users. This can run very rampant in that community. Unfortunately, medical workers that are working with blood and have accidental puncture exposures with needles. Any patient that's getting any kind of blood to person or organ transplant, hemophiliacs, dialysis patients, infants born to mothers with hepatitis. With HIV patients, it's as many as 1 in 4 HIV positive people also are positive for hepatitis. Sharing razors and unregulated tattoo or piercing clinics can also put you at risk. For symptoms, I'm not going to go through this whole list. It's very lengthy, as you can see, but some of the biggest symptoms that stand out are jaundice of the eyes and the skin. That's where it turns yellow. The white of the eyes turn yellow, the skin turns yellow. People will have a loss of appetite, swelling in the abdomen, but that jaundice is really a red flag for hepatitis. So the incubation period, it can be anywhere from 2 weeks to decades. A lot of people can be asymptomatic, which that's considered a chronic infection. They won't show symptoms for years and years. Some people can start to show symptoms. They get an acute infection within 2 weeks and they can start to show symptoms. With testing, as little as 2 weeks, RNA blood tests can show that an infection is there, hepatitis infection is there. So why is this important? The problem with hepatitis C right now is infection rates are increasing. It's 10 years ago, the infection rate is 4 times as high compared to 10 years ago. The opioid crisis is fueling that. That's a huge problem. 40% of infected people have no idea that they have it. That's a problem because the disease is deadly. If it goes untreated, it can kill people. The CDC estimates 1% of the population is infected. That's 2.4 million people. And it can be cured. If we find it early enough, we can cure it with very little, if not any, long-term effects. So how do we protect our staff and our patients? We're going to follow OSHA guidelines, standard precautions, which means we treat everyone like they have something that's transmittable, such as HIV or hepatitis. We're going to wear appropriate PPE, masks, gloves, eye protection. We're going to use sharp containers. We're never going to put needles in trash cans. We're going to use needle recapping devices to protect us from getting stuck with needles. Testing is the best, really the only way that we can diagnose, and that can be done at any kind of clinic or hospital that does blood testing. And if we have a staff member that has an accidental puncture exposure, we want to know because we can test, we can start medication very quickly. We're going to clean our rooms using EPA approved virucidal disinfectants, which we know will kill the virus. So some other considerations with hepatitis C, sexual transmission, it's unlikely, but it is possible. One of the best ways to avoid sexual transmission is the use of condoms. The CDC recommends anyone over the age of 18 get tested for hepatitis. Treatment can be expensive. So if you fall within a socioeconomic status where you don't have health care, that's going to be a huge problem. And people between 29 and 39 are the highest people that are affected right now. So that's a major concern. If you have any questions, reach out to me and let me know. All right. Thank you for listening.